I received a grant from ISOPP to do this research. As most people know, many people have a good understanding of reading, so that's called literacy. But we also have to think about how people understand numbers, especially in cancer. When we're thinking about a decision that a patient is making, we have to provide information to them about the side effects of the medication or the regimen, as well as the efficacy or effectiveness. And what we know is that even though people have education around mathematics or numbers, they may not be literate in numeracy or understand numbers well. Similarly, they can also have a deficiency in how they understand graphic representation of information. So what this study was aimed at trying to do was see if there's a better method to display information about numbers in a way that people can understand if they don't have that good high level of numeracy or graphic literacy. So what we did is we used a hypothetical scenario in a survey to cancer patients, and we gave them two different treatments that had similar effectiveness but different side effect adverse event rates. And we used information that just showed the number or the risk of adverse events. We used icon arrays, which is a common thing that's used to show differences in numbers. And then we used a thing called a spinner, which is really like a donut that shows what percentage of those patients have adverse events. And we were hoping that the spinners might do better for patients who are low in numeracy and graphic literacy. But in this study, most people scored very well on their knowledge of the risk of adverse events regardless of the numerical presentation. But those patients or participants who were randomized to the spinners study and had a high graphic literacy tended to be more willing to take a higher risk chemotherapy treatment in the hypothetical situation. We did not reach our full recruitment yet, so we're going to continue to gain more enrollment in the study, and hopefully we can then reanalyze the results and see if there are any differences once we reach that full enrollment. Then from that, we'll take those results and design the next step of the study to see maybe if we could use this, if one of these number presentations is better, we will try to use that in a real life situation for decision making.